In the name of Allah, who is the most merciful, the most beneficent, today we are going to discuss about the history, how take the history of the patient. So the first is, uh, I said welcome to all of you. Uh, while the taking in the history of the patient, the first thing is biodata collection. I mean the identification of the patient. In first, we are the name, maybe the name uh, male or female, and the second is father name, age, phone number, occupation, address, gender. These things will be included in identification. The name, first of all we should talk about name. The importance of the name is, suppose you have different patients in a ward by the same name, so we have to differentiate it between them and ask the father name, write their father name and their name as well. This is the differentiation. And age, some disease are related to the age. Some disease are in old age, some are in early age. And occupation, some disease are related to the occupations. For example, the people who are working in uh, industries or in the factories, they met always with the detergents and face the detergents and paints, like such like things, so their skin may be uh, damaged or some rash, some scars come there. Therefore occupation is importance of occupation is this. Then we have come to the address. Mean you have to ask the proper address. The proper address of the patient should be mentioned here, so that you follow up the patient. And gender, male and female. Most of disease are related to the gender, like some female have different diseases and male have different diseases. And then you have to ask from the patient uh, about the phone number. The phone number will help you, and for coming back to ask something, to follow up to your patient while the patient is good or not. And you have given some wrong drugs to the patient, maybe you reform that. And after that you have to ask from the patient openly questions, like when you met to the patient at the first time, introduce yourself to the patient and ask him questions friendly, and so that the patient feel comfort. And the second is, for example, if we asking openly question from the patient, like what is your problem, what's up, what make you visit me, mean for what purpose, for what problem the patient come to the doctor, he visit to the hospital, mean the main point why he visit the hospital. Then the patient will explain by his own words. And don't ask close question from the patient. If patient is not understanding your language, you have to ask freely questions. And for example, you are asking from the patient, are you upset, are you feeling fatigue, okay, and you're so talkative. And don't put pressure on the patient, and don't punch him. And then um, ask the patient politely. Some patient may come to you, maybe they be deaf, maybe unconscious, or maybe they cannot speak well, or maybe their language is different. And so you have to be so patient and the time. And maybe some patient attending science language or translator. Whenever a patient come to you, when he don't know understand the language, maybe translator come there, so maybe you can ask from that. So this was the identification data for the patient. Okay, the first is a first name, father name, age, occupation, address, gender, phone number, and openly questions. Don't ask close questions. So this is uh, identification, how to take uh, by date of the patient. Inshallah, we have to be made in next week's due. Thanks for watching.